Hey guys, Rena, Malik, urologist and pelvic surgeon here. Welcome back to my channel. Today I'm going to be reacting to Johnny Knoxville's urethral injury. So one of you guys recommended this for me, and I found a couple clips where Johnny talks about his urethral injury on Variety and on Opie Radio. So let's watch, and I'll talk a little bit about what happened, why it happened, and what to do if you have an injury, what to expect, and all those sorts of things. Make sure if you like what you see on this channel, hit that subscribe button so you don't miss any of my new videos.
We were filming Matt Hoffman's tribute to Evel Knievel, and I decided, well, I want to have some fun too, and decided to try and backflip a motorcycle, but I can't ride a motorcycle that well.
Y'all, don't do that. If you don't know how to do something, learn how to do it. If you want to do a stunt, get trained how to do it. Please don't do these crazy things. You can really severely hurt yourself. And he's actually lucky that all he came out with was a urethral injury from this, because it could have been a lot worse.
How come you don't wear a cup, at least, when you're wearing like some padding or anything?
It feels like kind of cheating.
No one's going to know, though.
No one's going to know.
Yeah, it's not on the outside.
Yeah, I don't know. I mean, if I was thinking logically, I wouldn't have been doing that, you know?
Yeah, really important. Wear a cup and protect your junk. It's important.
Whatever you do, do not ditch the bike right away, because if you go like this and ditch the bike, then it goes 40 feet in the air and lands on you. Yeah.
And on the fourth time, I come off the end of the ramp, let go of the bike, it launches 20-something feet in the air, and I fall back down on my back, and my knees are behind my ears. Like when I fall, I'm like, and right at that time, the motorcycle comes down and breaks its handlebars off of my crotch.
Oh, y'all, that is so painful looking. So that's called a straddle injury. And a straddle injury is when you have any sort of trauma to the groin when your thighs are spread open. And that can cause injury to the urethra, which is the tube where you pee from, the perineum, or what's affectionately referred to as the taint, or your pelvic bone. So straddle injuries typically happen to people when they're falling, off their bike seat onto the bar between the bike, or where you fall on something really hard. This is obviously a very unique way to get a straddle injury, where a motorcycle falls on top of you just at that right location.
I stood up and I felt like I was peeing myself. Every time my heart would beat, blood would shoot out the end of my penis.
I injured the only body part that means anything to me.
So it sounds like he has hematuria, and this is obviously due to a trauma, but there are a number of other causes of hematuria. I talk a little bit about them in my reaction to House, where they have a patient who comes in with hematuria, so you can check out that reaction video. But he has blood in the urine after a trauma, and that would absolutely require him to go to the emergency room. Typically what we do when you come to the emergency room after a trauma and have blood at the meatus, you undergo a workup for a urethral or bladder injury. So the first thing is a retrograde urethrogram. What ends up happening is you get put on a table, kind of frog leg, so that we can see the urethra really well, and then we inject some contrast into the urethra, and then you can see the different components of the urethra, the anterior urethra or the posterior urethra, as well as if it fills into the bladder, and you can determine where the injury is. The next thing of most importance is getting your bladder drained. And so whether that's with a suprapubic tube or a catheter that goes in from the skin into the bladder directly, and I mentioned that before on my reaction to Grey's Anatomy, I'll link that here as well, but a suprapubic tube is a way to put a catheter in through the abdomen and allows you to bypass the urethra. Or if you can get a catheter across the injury gently, that's okay as well. So those are usually the first two steps.
Yeah, I had to go straight into surgery, and it was a tear in my urethra.
Oh my
and
God.
And it was taped to my leg for 4 to 5 weeks, and I had a bag on my ankle that pee went in, and it sucked when you got erections because your penis was
breaking. It's
taped.
like the Incredible Hulk, right? It starts breaking out of this whole thing.
It was
And it's green. It's bruised.
Yeah, and it's taped down at a right angle, so it's like very painful.
So it sounds like he had a urethroplasty or repair of his urethral injury. And depending on where that is, typically if you look at the reported literature on straddle injuries, you'll find that most of them are in the anterior urethra. And typically, the large majority can be repaired with just a primary anastomosis, where essentially you clean off the edges of the injured urethra and sew them back together. And then you do leave a catheter for some duration of time that can range from 2 to 4 weeks to allow that area to heal. And then you do another retrograde urethrogram after you remove the catheter to make sure it's healed correctly. It can be as short as 2 weeks or as long as 4 weeks where you have a catheter. And there are obviously trials and tribulations to having a catheter. It is secured to your leg because we don't want it to get pulled on or tugged on or ripped out, because that can create, one, a lot of discomfort, and two, it can damage the repair that you just recently had done. So we do secure it quite well. We try to secure it pretty loosely so that you can move around comfortably. I don't know that a lot of men are having erections with catheters, but maybe there are. Having a urethral injury is no walk in the park. So maybe wearing a cup would have saved this guy a lot of problems.
How long were you laid up?
It was 4 or 5 weeks. I had to pee into a bag, and then I had a catheter twice a day for 3 years after that.
Twice a day for 3 years?
Yeah.
When did this happen, this thing?
That was in 2008, I think. And then for 3 years, twice, like a tube about...
Is that the only way you could piss?
No, I could pee regular, but they didn't want the hole to close up, so...
So
what
put
would
a
they
catheter
do?
in to keep it open.
Yeah,
Kinda
yeah.
like you
Just
putting-
bore it out.
It's like keeping in earrings so that your whole so they don't heal. Otherwise, your dick hole would have healed, and then you would it would have blown up like a balloon of piss and exploded. That's actually exactly what
happens.
Yeah.
That's exactly how the doctor put it to me.
Yeah,
Thank you.
Sure.
So you'd have to carry that on the road with you twice a day and do it.
Everywhere, yeah.
So what he's describing is called clean intermittent catheterization. And typically it's done for patients who cannot urinate. So people who can't urinate for a variety of reasons. And you can learn more about urinary retention on my last reaction video on urinary retention. So what happens when you can't pee for some reason or the other, you can learn how to catheterize yourself by a nurse that's trained in catheterizing. And you can actually place a catheter in your urethra yourself that allows you to empty urine out of the bladder. This being done after urethroplasty, there's actually no great data on doing clean intermittent catheterization to keep strictures open. And particularly after urethroplasty, there's just not a lot of evidence-based data to support or negate doing this practice. So some people do routinely have their patients catheterized after urethral repairs to prevent recurrent stricture formation. And the timing of that, or how often you have to do it, is really unknown as well. Do you just do it every day, twice a day, once a week? We don't really know. So the only study I could find was one that was very small and that only looked at 126 patients, of which only 31 actually catheterized after repair of a urethra and 95 did not. And they found no difference in recurrence whether you catheterized or not. So based on that study, I don't typically do it. But again, it really depends on how things looked after his repair, where exactly his urethral injury was. And this might have been the best thing for him, because having a recurrent stricture is really, really challenging, and you want to get the best repair the first time you do surgery. So I hope Johnny Knoxville is doing great right now, and I think he stopped doing all these crazy stunts, but who really knows? And so let me know what you want me to react to next in the comments down below, and thanks so much for watching. Always remember to take care of yourself because you're worth it.